Well, hello, Pahrump. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, and tonight is a live show. I wanted to welcome myself back to the show after being gone for 3 weeks, and it's kind of a joke, but I did take a vacation for a couple of weeks and then came back and then found my office kind of swamped with work that was left undone for a couple of weeks, and just a little confusing to get here last week. And of course, we had a big 4th of July weekend this weekend and had a little lighter schedule and was able to make it in to the show. And as you know, it always is a call-in show, so I know that there were a few people that probably were disappointed, like Ray, the flagman. Hopefully he's out there tonight and will call in with an interesting question. He always has pretty good ones, and I appreciate the call-in. So that's 727-8750 for those who choose to call her. Well, I guess we do have Ray. Ray, are you there?
Yes, welcome back, Doc.
Thank you, Ray. I heard you were kind of disappointed I was gone for a couple of weeks.
I was watching, and I'll tell you, I learned a lot even from the replays.
Okay, good.
Things that you said on the replays, I said I did not absorb it the first time around.
Yep.
So it was not a complete negative, but it was good. It's good that you're back.
Right.
I saw something on the news tonight on Channel 46, a study on prednisone for sciatica, and they said it works as good as the placebos. Now, isn't that something? It works as good as placebos, except the sciatica has some side effects to it. So, I mean, the prednisone has side effects to it. So I thought that was a little humorous, you know, to work as good as the placebo. My question is, as far as, I have a friend who's diagnosed as being a diabetic, and he claims that he has no energy unless he has a candy bar once in a while, and he thinks he's hypoglycemic. That's the term he uses. Could you explain that and get me a better understanding of what that's all about, and if there is such an animal? I'd appreciate it. And welcome back, Doc. Thank you.
Thanks, Ray. And yeah, those are very good comments. Let me just address the sciatica and the cortisone first, and then I'll get into your question about diabetes. But that's interesting because sciatica really, I think if you take all treatments for sciatica and spread them out, you might find they might just be as effective as placebo. Really, it's time to heal. It depends what the injury is, of course, but let's suppose you just throw your back out and that's an initial injury. When the muscles go into a spasm, they actually will tighten up, and if you look at x-rays of sciatica, looking at what we call the, not the AP view, which is straight on unless you have scoliosis, but if we look at the side view, the lateral view, you will see a straightening of the spine, and the spine normally has a natural S-curve, and then in the lumbar region, and then it goes to a convex curve in the thoracic, and then it goes back up to the S-curve. So the two areas that get strained are the ones with the S-curve, the lumbar and the cervical. So we don't hear about thoracic strain, and we do not hear about coccygeal strain or pelvic strain. So, and the reason is because the muscles tighten up and they actually pull the spine, and it's a term called loss of lordosis, and they'll see it a lot on the x-ray, and that's because the muscles are indeed in spasm, and that is disturbing the actual outflow tract of the peripheral nerves that exit out the side of the spinal column. And that's where you get the sciatica that radiates down in the distribution of the nerve down into the back and into the leg. That being said, sciatica basically is just a symptom, and what is the cause of that? Well, like I said, it could be a strain, could be what they call degenerative disc disease, and as we get older, our discs become thinner and they lose their water, so they become arthritic, and you may turn one way and catch a little bit of that arthritis, and that sends it into a spasm. And normally it's just rest and relaxation, getting off your back, taking maybe a mild muscle relaxant, taking an anti-inflammatory like an Advil or an Aleve will relieve the inflammation in that area, and eventually the spine will straighten out and loosen up, and the spasms will go away, and they will get better with time. saying that, cortisone is given to a lot of people to reduce rapid inflammation. And it just doesn't make sense in some cases to give something by mouth and expect that you're going to deposit a large amount of that medicine right where you need it in that particular area. That's why I like Voltaren gel or things of that nature, where you can deposit 100% on the skin. You can get 20% maybe penetration into the joint, and you get 4% dilution into the body, as opposed to taking 100% of the medication in your mouth and then again distributing it through your entire body, depending on how much is absorbed, what your gastrointestinal tract looks like, how much blood flow you have to the intestinal tract. All of those factors will determine, when you take a pill, called bioavailability, how much of that drug is actually available to your biosystem. And that varies from everybody. So cortisone has a lot of negative side effects. It affects your liver. It causes what they call gluconeogenesis, which it's the opposite of storing sugar. It causes your liver to break down. It actually causes your muscles to become catabolic. It breaks muscle mass down. And that's why some people who take cortisone will notice that their muscles ache, because it's breaking that muscle down. And it can also can cause cataracts if you use it for a long term. If you take more than 2 grams in a lifetime, it doesn't matter whether it's oral or whether or not it is by injection, you run the risk of what they call aseptic necrosis of your hip. And it's a vasoconstrictor, so cortisone constricts blood vessels. So if you use it on your skin, it's going to cause thinning of your skin, likely to break down and tear. If you use it in your nose and nasal cortisone, one of the risks is nasal bleeding from thinning of the mucous membrane. So while cortisone is very useful for severe inflammatory issues like arthritis and things of that nature, when your immune system is just hyper-revved and going 110 miles an hour, cortisone is very useful, because those effects can be more damaging that. So as it is with medicine, it's a risk-benefit ratio. So I think the statement of using it as a placebo in your back is correct. I do believe that over the long term, you don't benefit from chronic steroid use in your back at all, and there are better uses of that medication for that. So I hope that clears that up. Now, with regard to hypoglycemia in a diabetic, that's a very common situation because of the medication that they're probably on. If they're taking insulin, a lot of diabetics are, and I hate to say this, I know it's a bad word, but they're kind of helter-skelter about their treatments. And a lot of that has to do with practitioner problem, because we don't really explain all the different medications and how they're used and the side effects thereof. So that being said, one of the greatest ones, the oldest kind of old school diabetes treatment is insulin, when they would use what they call N-insulin or Humulin N. They have regular insulin that actually has a peak. If you inject it in your skin, in your subcutaneous skin, it becomes a peak within 2 hours of activity and can last anywhere from 4 to 6. Well, back in the 80s, they had what they call Humulin N, which would last about 12 hours. So imagine you would give yourself a shot in the morning, and then it would peak about 8 hours later. If you forgot to eat, well, guess what? Insulin's lowering your blood sugar, so you're becoming hypoglycemic, and so you're racing to the kitchen to eat, and you eat, and your blood sugar goes up, and it stays into effect from, 12 to 18 hours. And you couldn't time it if you wanted to. So people were getting a lot of hypoglycemic episodes, and now people will use this long-acting Lantus insulin or Levemir, and that's the only insulin they're on. Well, that's another misnomer, because your body makes 2 kinds of insulin. It's all insulin, but it makes basal insulin, which means it makes it all day long to control your blood sugar. You get a little bit to being in your system all day long, and then when you eat, you get a spike. So this long-acting insulin, Lantus, if you're trying to control your blood sugar with that, you will miss the postprandial spike or after your meal spike in blood sugar, and because you don't have enough insulin on board. And you will find that if you go for long periods without eating, your blood sugar drops very low. Now, nobody's really talked about this, but I believe just like there is a baroreceptor in your body, meaning blood pressure receptor, and if your blood pressure was normally 140 over 80 or 160 over 100, and I dropped your blood pressure down to 130 from the 160, you would feel it. You would feel tired, you would feel weak, maybe a little somnolent, you would want to go to sleep. And then with that situation, the same is true with blood sugar, because I had patients that exist in the 300 to 400 blood sugars. You give them something to lower their blood sugar, and guess what? They feel very tired and fatigued with a moderate blood sugar. So I believe your body is used to a certain level of sugar. So if you take someone that's a diabetic that was running 150 and all of a sudden they're taking a prescription and it's dropping it down into the 100s or even 90, which would be normal for most people, they might feel a little fatigued. So I hope that answers that particular question. It is a very common problem, especially if they're using pills like sulfonylureas, which are, again, an all-day pill, or at least a 12-hour pill. They whip your pancreas to make insulin, and so people, if that person is doing that, or if you're a viewer out there and that's what's happened to you and you're on oral medication or you're on long-acting insulin, you need to meet with your provider and discuss the symptoms you're having, because there should be and there could be a better regimen out there for you so that you could get more in tune and feel better. I love long-acting insulin with short-acting mealtime injections. We're going to go to break, and we're going to come right back. And thank you for tuning in, and hopefully there are more callers with more questions. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physician specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.